Okay, welcome back to Emotionally Unavailable. Will you pronounce your last names for me?
Sure. Sauer-Zavala.
Okay, I was so close in my head. Excellent. I'm glad I asked. Well, it's so nice to meet you. I'm really intrigued by your work. I was looking at your profile again earlier and um I don't know, this really I'm gonna look at it again because I was wondering, I was trying to remember what part was like, oh my God, I want to talk about that. Um, I don't know. I think just in general, I've recognized how many things other people feel are fixed. And personality I mean, it's so much. It's so much of who we are. And especially like people who really get into that place where they become a person who doesn't try new things because like we know it's because they're afraid they're not going to be good at it, and or they know they won't be perfect at it the very first time they do it. Like having seen things like that 10 years ago without a full understanding of them versus now, it's just so interesting to me. So, how did you get into you're a clinical psychologist. How did you
Mhm.
get into the work you're doing?
Yeah, so right, like you said, I'm a clinical psychologist and I am also a psychology professor and treatment outcome researcher.
Wow.
When I went to grad school for clinical psychology, right, wanted to be a psychologist, wanted to like help people like any budding mental health professional. And as I was working through my program, I realized that maybe the best way to help the most people was to be on the research side, developing treatments that are more efficient, are more potent, are more likely to be picked up by mental health providers and used with their patients. And so I got into studying personality because it's a really efficient way to think about mental health difficulties. So the
Mhm.
like kind of gold standard in my field is like if you have panic disorder, there's like a treatment protocol for panic disorder. If you have depression, there's a treatment protocol for depression. If you have generalized anxiety disorder, there's a different one for that. For OCD, for borderline personality disorder, which is my specialty, there's a different manual or different protocol for every disorder in the book. And that doesn't really work very well for a couple of reasons. One, most people have more than one condition. Um, so
Right?
so it's kind of like, okay, well, what about my social anxiety if we're using the panic manual? And then the other reason, and this is really where I think like thinking about personality makes the most sense. The other reason is that therapists that actually provide clinical work in the trenches are super busy. And so they don't have time to learn 60 different protocols to treat all the disorders in our book. And
Right.
yeah, yeah. So what they do often is fall back on like, well, tell me about your week, right? Which is not evidence-based if you have some particular problems. And so basic research tells us that like basically all the different forms of mental health conditions can be accounted for by just five personality traits. These are like vulnerabilities for these disorders. Turns out, if you target the traits, you can see simultaneous symptom improvement across all the problems that people have rather than kind of playing whack a mole with different symptoms. So that's how I got into it.
Wow. That is very interesting. Okay, let's break that down a little bit. So, let me make sure I'm understanding what you're saying. Um, because somewhat from a clinical standpoint, probably more from a spiritual one, I would
Yeah.
say there's not that much uniqueness in most things, like in people's stories, in their reactions, in how they got their wounding itself. Like it's the same thing in different font over and over and over. And
Hmm.
I will be really honest, for a half a second one day, I was like feeling insecure, I guess, about myself clinically because I don't know, how you can get imposter syndrome just randomly,
Totally.
And
Totally.
and then I like really had to lean into what I know to be true, which is it's you don't have to be specialized in EMDR or specialized in this thing to be really good at what you're doing. And that it's again, it's I would never have classified it the way you are with the language you're using. So I'm so excited to hear like your information, but it is
Yeah.
also providing some comfort to me because I'm like, yes, see, I
Good.
know when I'm doing shit.
Yeah, yeah, well, exactly, right? So, like, one of the things I mean, I think what you're describing is, like, what we see clinically, right? Even if you're not describing it using, like, the research language that I am. So, like, what we find is that people that tend to experience their emotions really strongly, so they're, like, higher on the personality trait, we call it neuroticism, though my publisher says that people don't like to be called neurotic, so we're rebranding it as emotional sensitivity now. Um, but people that
That's
are
why they're
higher
calling people highly sensitive people instead of
right.
neurotic.
Yeah.
I
I mean,
love it.
I identify as neurotic, so I don't know.
I kind of
But
am too, so
yeah.
I'm sure that's obvious.
Um, so people that are higher in neuroticism, they feel their emotions really strongly. They tend to not like their feelings very much. Like, I hate this feeling. I shouldn't be feeling this way. It's weak
Lots
to
of
feel this
judgment.
way, right?
Yeah.
And so we see that like it doesn't matter if you have OCD or PTSD or panic disorder or depression. Like, we see that same pattern. And so the thing that's different about the different disorders is what you do with that. In panic, right? You just like just make your circle smaller and smaller and smaller so they're not going into situations where you might feel that rush of emotion. In depression,
Mhm.
you're withdrawing, you're napping, you're canceling plans. In generalized anxiety, you might be checking. In PTSD, that might look like hypervigilance, right? And so the actual symptoms look different, but the way you got there for most people is pretty similar. It's the same risk factors. And so again, it's like way more efficient to target like I feel something, I don't like it, and I try to avoid it than it is to treat different diagnoses that really
Yes.
are just, like, made up anyway by, like, men in a room writing the DSM.
Thank you. My son is currently in school for psychology,
Amazing.
and he finally got to the DSM, and I, prior to him going to school for psychology at all, had to be very careful about language because I have been under the impression that DSM is bullshit for quite a while, and, like, to me in my soul, I was like, it's just a list of characteristics with a label. Like that's all it is. And when you understand how insurance was created and what the system is designed to do, you know why this book exists. Let's not forget homosexuality used to be a diagnosis in the DSM.
Mhm.
So having said that, there was some things because like he had a friend a few years ago get diagnosed at first with bipolar. And I was like, "Oh, interesting. Okay." And I say nothing, right? Because I'm loving and supportive. And I'm like, "Oh, okay." And then 2 years after that, it was, well, misdiagnosis, actually ADHD. There's all these things. And I was like, "Oh, interesting." I say nothing. So I finally am able to be like, just so you know, I fucking hate when people are diagnosed with bipolar or borderline personality disorder 'cause those are the 2 that I see become the hugest center of their universe. That label, that's it. This is who I am, and that means I check off all these boxes forever, even if I'm in remission, and I'm like, "Guys,
Mhm.
it's not cancer." Like, fuck, you
Yeah.
know?
Yeah.
So
Well,
I
that's the
love what
thing,
you're
like
saying.
yeah, I mean, totally, like, the DSM really, I think, like, in some ways, like when we think about evolution as a field, there are some ways that it has been helpful, right? I mean,
Sure.
the with DSM-3, like we got like different symptom sets, right? And that really led to an explosion in treatment outcome work, which great.
Yes.
Really was a huge advancement in the field. And there are also all of these problems with it, right? So it doesn't address comorbidity or co-occurrence of more than one disorder. And like what you're describing, this like frequency of misdiagnoses or like I mean borderline personality disorder is my specialty, so like this is the one that I always talk about, but like two people can have a BPD diagnosis and share zero symptoms in common. There are 256 ways that you can meet DSM criteria for the disorder. And so it just doesn't really give you that much information about the specific person that's walking through the door. And so I think that's a really important, like, borderline personality disorder fact. It's also borderline personality disorder awareness month.
Is
So,
it really? I
so
didn't know that.
Yeah, so it is worth kind of saying that, like, many people, when they receive that diagnosis, will, like you said, get on the internet and read all this, like, really
Yes,
stigmatizing stuff about the
yes,
condition that really is, like, it's untreatable, it's lifelong, it's just
yes.
how you are, you're always gonna struggle with relationships, and that is not the science at all. Like, people with BPD, recover, and they
Absolutely.
once you recover, you, like unlike depression that tends to be, like, kinda cyclic, once you recover from BPD, you don't slide back.
Well, yeah. I mean, okay, so to be clear, I'm a person who back in old 2009 was looking through my DSM being like, I I might have BPD. Like I really could. Like I got a lot of these symptoms, you know?
Yeah,
And
sure.
as I've like really unpacked my wounding and really confronted so many things, I've I have lots of narcissistic traits. I have lots of all of those things. Like personality disorder, it's me. Like name one, I can tell you 5 symptoms I have. But I'm so grateful that I didn't take the path of getting diagnosed with something like that because for me personally, I'm not against people being diagnosed, but I would have been one of those people that was like, "Oh, I'm just batshit crazy." Could you go
Mhm.
watch a movie like Girl Interrupted, which was the movie of my generation,
Oh, same.
and Susanna had BPD, okay?
Mhm.
So, I was like, "Susanna crazy," and that's that, and then she got friends
Uh-huh.
with Lisa, who was more crazy and, so that was kind of the face to that for me,
Right, right.
and I'm
Totally.
so grateful because now I'm just like, "Oh, it's protective factors. It's just me trying to protect myself all the time. So let me figure out that and
Yeah,
not, oh, I have the weight of this diagnosis. And again, I'm not taking away from the fact that like the diagnosis is real, but it's just the way we respond to that as humans sometimes.
yeah,
And then like people can be wrong about things too. So
yeah.
I'm yeah, I don't have a
No,
real
I
thing.
think that that totally makes sense. I think that, like right, like, I've seen it kinda both ways, right? 'Cause I work with a lot of people with BPD. Some people find, like, the diagnosis really comforting because
Mhm.
it's like, "Oh, all the like, relationship problems and strong emotions and impulsivity, like, all of this stuff that feels like a lot of different problems can be organized. Oh, there's a name for it, and, like, there's a
Right.
treatment for it." So a lot of people really like that. But, like, I love what you're saying because I think what you're describing is really similar to, like, how I think about BPD, which is that, like, it's a bunch of strategies that like, the symptoms are a bunch of strategies that people use to keep themselves safe. And often, when it comes to treatment, it's, like, not so when I work with people with BPD and in my lab, we develop treatments, right? Personality focused treatments. And one's called BPD Compass. And we start with values. So we're sort of like, what's important to you? Like, how do you want to show up in the world? And then we kind of like try to understand why you're approaching the world the way that you are. And what I find is when you start therapy with, like, okay, these are all your problems, these are all the things that are, like, wrong with you, it's not
Mhm.
particularly motivating, right? So we start with where you want to go. And then, the skills are like, oh, like, when you start to feel uncomfortable in a relationship, you leave or you don't ask for help because you assume people will say no, right? Like, let's just dip a toe in. How can we test that hypothesis, right? And it's like understanding why you're behaving that way because people don't do things.
Right.
You're not crazy. It like makes
Y
sense. It might be
exactly.
outdated.
And that you just said it. The shift between I'm just crazy and I just got some shit I gotta shift. Like
Yeah.
because that was I believed I was crazy because I had a lot of noise in my head. I
Mhm.
I didn't even have a beginner's understanding, even with any sort of clinical background of why I was behaving the way I was behaving. I mean,
Yeah.
truly. And so it took being able to learn to quit intellectualizing things and
Mhm.
to actually experience feelings before I ever even had the opportunity to
Yeah.
become aware of the fact that
Right.
I
Right.
pushed everyone away.
Gotta sit
And
with
the
yourself long
stories I
enough
tell
to
oh,
see.
yeah, exactly. Yeah. I just had to learn, like, you got some real convincing stories happening to
Mhm.
confirm this narrative that you believe really true, and now you're gonna bust hell wide open to confirm that narrative. But it took so long to get there. Like, it was like a full year of being less anxious, like all that stuff, dealing with PTSD symptoms essentially before I
Yeah.
could actually like uncover any of the emotional stuff. But yes,
Mhm.
we're not crazy. And even though we act crazy sometimes, we're not crazy. And there's just a few shifts. I don't even think that they're that like big or difficult to make those shifts once you're really aware and learn how to integrate. Am I wrong for that?
Yeah, right. In our treatment, so BPD Compass, the one that we've been testing in clinical trials, it's only 18 sessions long. So, it's like a
See?
couple of months. And, with real
Yes.
dedicated, it's meant to be personalized too, because with BPD, there are some people that come by it through like, I'm just very sensitive. And there are some people who come by it because they have had experiences in their past that teach them that, you can't really expect much from other people. And then some people are just wired to be a lot more impulsive, right? And so we have to kind of understand like how your pathway. So that's one of the ways
Right.
that we start. But then it's personalized. It's potent. It's not like learn 300 different skills and we'll see what sticks. We're able to do it more efficiently because we're figuring out what's like kind of driving your behaviors that you want to change and targeting them really specifically. But yeah, 18 weeks, a couple months, and we see this is like in the weeds of research, but we see like a clinically meaningful like effect sizes that are large in magnitude, which in like the research land is like really good,
Yeah.
that are comparable to what we see for people like kind of average improvement that we see for people that have had a year of DBT. So really
Wow.
impressive results.
Yes. Wow. So again, just to kind of rephrase what you're saying, just to keep the audience a little bit oriented. You're saying that in your work, you're learning we don't have to know all of these clinical skills or modalities, we'll say. We just narrow down to a few key things and attack that together with the client.
Yeah, yeah. So right. So BPD, like the more like kind of modern way to think about it, instead of like those 9 symptoms, is like it's like elevations in neuroticism. Now, these are like stigmatizing personality words. I didn't come up with them. I'm just going to use what the field uses, but
Sure.
neuroticism, antagonism, and disinhibition. I think antagonism is the worst one because it makes it seem like you're antagonizing people, and that's not really what it is. It's like you don't trust people,
Right.
probably for good reason. So it's those 3 sort of like targets, and people can get like you could get just the skills for neuroticism, or you could get the skills for all 3, depending on your picture. And then across those 3 like personality domains, there's like thinking like skill for flexible thinking, skill for changing your behavior, and mindfulness. And so it's like there's actually really good data that show that having a lot of skills and like rotating through different things that you're trying actually is like more akin to like emotional flailing. It's not actually linked to like good outcomes, but actually being really, really good at a couple key skills that work for you is like much better for functioning.
Yes. Oh my gosh. Okay. Again, that like really just validates me because as a
Good.
human, like not like as a clinical person, as a person who's doing this work on myself all the
Yeah,
time, um at first first I really didn't understand because it took a while to really, really get intimate with what my wounding was and
sure.
why I was doing what I was doing. So I the I heard about trauma for real, outside of like veterans about 2017. Look, I don't know if you're familiar with the holistic psychologist, but I started to see her on
Oh, yeah.
Instagram.
I
Yeah.
follow her.
Okay. And I was like, interesting. And so I started to I understand what she was saying then so much better now, but
Hmm.
I didn't understand. I didn't understand at all. But I was trying because I was that was my gateway into like, oh, I'm not just mean. I'm not a bad person. I have
Hmm.
trauma and these are
Yeah.
trauma responses. So that was my
Right.
gateway into it. Then just learning any because I was like, I felt like her big thing was nervous system regulation, and not that it shouldn't be, but at the time, either she wasn't talking a lot about the behaviors and the wounding, or I just didn't understand it, so it didn't sink in. But
Yeah.
in either case, I was like, oh, I just have to learn to regulate my nervous system. I didn't understand why it was dysregulated to begin with. So
Yeah,
I'm
right? It's
trying
like, "Oh,
every
just
little
be different."
modality. Yes. I'm like, oh, it just means I'm okay. I understand what dysregulation means. I don't understand anything else about this. And so it
Right.
was like,
I'm dysregulated. What do I do now?
so I'm
Yeah.
trying all these things, and now I feel like I have a little menu that's just
Mhm.
right here in my brain at all
Yeah.
times to where first I'm hitting those physical needs, and then I'm like, "Okay, and now what are my emotional needs?" But I don't have to, like, try a bunch of new things
Right.
to figure it out, and so that makes so much sense to me.
Yeah. I mean, it's so cool when like the research, right, aligns with with clinical experience, like your personal experience and experience with clients, right? And I mean, this is part of the reason I love talking to other mental health professionals, um especially people that don't like speak necessarily the research language. I get tired
Yeah.
of talking to other academics that, I don't know, don't see I mean, I see clients, but a lot of my colleagues don't. And so we're not really talking the same language, or we're not seeing the same volume of clients that people who do this full time do. So it's really nice to see that, oh, like what I'm thinking about and what I'm doing, what I'm putting into my treatment is really like aligning with what people are actually experiencing.
Yeah. No, I feel that because I think in some ways it's a little bit healing for me every time like walk someone else through this same process because
Yeah.
for one thing it really does confirm what we talked about when we first started talking, which was like there's not that much uniqueness happening. Like the human
Hmm.
experience lays things out kind of similarly for all of us. And so
Hmm.
I make that point because when I realized I'm not an anomaly, I'm not an other, I'm not higher or lower. Like, we're all struggling with some form of most of the same stuff. And it doesn't have to be that hard. Not for the people who want to help us, not for ourselves, not for people we want to help. Like, it doesn't have to be so complicated. And I also think it helps alleviate any insecurity that I had over not specializing because I've been asked that question a couple of times, like, what is your specialty? And I'm like, if I have to say something, I'll say trauma, but, like, I'm not over here, like, if what I do for CEUs is for my own benefit. So,
Yeah.
like, I'm not going to spend some 35-hour certification so that you feel better about my skills.
I and Okay, I'm obsessed with you. So I mean, this is so great. Like, so it like you said that I'm validating you. I feel like you're validating me because, I would describe myself, I mean, I guess I have said several times today that I specialize in borderline personality disorder, but mostly like, you know, like if I really had to drill down what I do, it's like developing trans diagnostic treatments, which essentially just means treatments that target those shared mechanisms that lead to problems. That it's like people kind of are on the same path, and they may manifest different symptoms. It might look different on the surface, but it's sort of the same stuff going on underneath the hood. And then a part of the reason too that like I'm a treatment developer is and why I really like working with BPD is that, like I said, most of the our treatment is 18 weeks long. People get better really pretty quick. Um,
Mhm.
the other treatments for BPD work really well, and they require a lot of training, and
Yeah.
they're really intense, right? So DBT, which is like, which I think is a great treatment. It's one of the first treatments I was trained on in graduate school. It works really well for people that are chronically suicidal, right? But
Mhm.
like 50% of people with BPD will never attempt suicide. So it might be so thrice weekly treatment might be kind of overkill for those folks, and also, it's very expensive to get trained. And I kind of think like what is better care for people is not putting up a paywall, like making it easy to learn to provide treatments. So like BPD Compass, our treatment, when we were developing it, I wanted it to be short so that it would be different from the treatments that are available, and I wanted it to be generalist friendly. And I say this all the time when I'm giving presentations. So it's like a CBT format because that's the modality that most people are trained in, or at least have some familiarity with
Right.
in graduate school. manual, and then I wanted it to be like a manual. I wanted it to be a book that you could buy on Amazon and that you could read through it quickly and be like, these are familiar skills, but I'm applying them to like personality change or personality symptoms, and feel like, oh, because a lot of like generalist clinicians, particularly for BPD, will say, "Oh, I don't treat BPD." And I'm like, "Well, you know what? You do. You may not think that you
You
do,
may
but
not
you."
know you do, but yeah, you do.
And so rather than like refer somebody that could totally be treated in weekly outpatient therapy to, a 12-month long wait list for a specialist care, and then get into that specialist care and be taking a spot from somebody who really needs it because they're much more severe, like generalists can provide really good treatment if we give them the tools. It doesn't like not everybody has to be a specialist.
Yes. That's so real. And I hate that I'm seeing it more and more. First of all, I hate that I'm seeing those certifications offered
Mhm.
because they are so expensive and very time intensive. And I hate that imposter syndrome is so
Mhm.
real in
Yeah.
clinicians that they are willing to go and get all these certifications. And for me, that is the reason I didn't start a practice until after I had started figuring out my own stuff,
Yeah.
because I was like, what am I going to offer? Like, yeah, I can teach you about boundaries. I can teach you about this, but like, I didn't have this, like, I don't know, passion for, no, it's really not that hard. Cause I was still
Yeah.
struggling. I was in a mental health crisis. So I
I
was
mean,
like, what am I going to
totally.
offer someone? You know,
Yeah.
it
Yeah. You
wasn't
gotta put your
until
oxygen mask
after.
on before you can help others.
Right, right, and so it wasn't until after that I was like, "Oh, okay, so I can help with these specific things," and then as I was unraveling it all, I was like, "Well, that's kind of all it is these specific things."
Yeah.
Like, yes, it looks different on person to person, but when you get really intimate with yourself, it's so easy to hear when, like, I can hear a person's shame so loudly, I
Mhm.
can hear their
Yeah.
betrayal, I can hear all of
Mhm.
those things, and so we don't have to cast this wide net to be effective.
Mhm.
And on the same token, like for the consumer, for, mostly that's what this audience is.
Yeah.
Like it doesn't healing doesn't have to be hard.
Right. Right. It like or at least it shouldn't be hard to find a provider that can help you, right? Like sometimes like doing the work can sometimes be hard,
Right.
but like, access is a real thing and
Mhm.
when specialists have really long wait lists and, people feel like, "Oh, if you have a certain problem, I can't treat you," then it's really limiting access. And, I think like, you describe imposter syndrome and I wonder how many people are out there that could like open a practice, right? Because currently there really aren't enough mental health professionals to meet the need of, people in this country that require mental health care. And, I tell you what, like you're better than ChatGPT. Like imposter syndrome or not, right? So like hang a shingle.
Right. No, that's so real. I know. We're not even going there. Okay, so the part that I really want the audience to hear today is you're discovering that personality is not fixed.
Yeah.
And what that really like, what do you mean by that?
Totally. Okay. So, we we started with, your kind of question of like, how'd you even get into this? And then we talked for 30 minutes about the mental health system. But that's kind of how I came to personality change is by trying to make the mental health system more efficient because I know that these personality traits are risk factors for different disorders.
Mhm.
But then I started to think about it as like, well, why would intentional personality change just be for people who are struggling? Maybe other people maybe don't need to like shift their traits quite as much, but like want to be better in leadership at work or,
Mhm.
want to maybe they're a little perfectionistic and they want to nudge that down a little bit, right?
Mhm.
These are could we open this up a little bit or open the door a little bit wider? And so in terms of the mechanics of personality change, I think it's usually really helpful to start with, like what even is personality? And so the way that researchers define personality is actually pretty different than how it's just defined, I think, like, just normally or out in the world. And so personality is just your like characteristic patterns of thinking, feeling, and behaving, right? And really, really important, personality, or like when you take a personality test and you get labeled as conscientious, right? That is a description. It is not causal. So you are feeding the personality test like, okay, in a situation like this is how this is how I have normally behaved in the past, right? There's nothing when you get that result that says you're this much conscientious, right? There's nothing that says that you have to continue to be that way, right? That you can make those changes. It's not this underlying essence. And I
Right.
think a lot of people think that your personality is your values, your sense of humor, your taste in music. And it's really not. It's your patterns of thinking, feeling, and behaving. We change our perspectives with new information all the time. Based on like how many copies of Atomic Habits has sold, people are changing their behavior, right? And we change the
Right.
things through experience. And so that's how we can think about personality as not fixed, because when you take a personality test, you're getting a description or a label of how you've behaved in the past, but it doesn't have anything to do with how you'll behave in the future. You can actually make some shifts.
Oh my gosh. So you know what that made me think? If your belief was that it was fixed when you got assigned that label and all the little attributes within that label, and you didn't get any new information about whether or not it's fixed, that's a part of like your internal narrative now that you're going to
100%.
confirm. Like it's
Yeah.
now a part of your bias and how you
Yes.
view the world.
I have literally had patients come into session and, say, I just can't set a boundary. I can't be assertive because I'm an INFJ. And I'm like, there's a
I
lot to
love
unpack
you.
there.
Yeah.
There's a lot
Mhm.
to unpack there.
Yeah.
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 And you have heard me talk about neuroticism and conscientiousness, right? Like, you'll notice that I have, like, I mean, there was just like a subtle dig at the Myers-Briggs. So I'm not here for a type-based test.
Right.
Myers-Briggs or Enneagram, they weren't developed by like scientists. Like Myers-Briggs was developed by like a lady that was observing kids in her at-home daycare. So and now it's like $1 billion business, but
Shut
yeah,
up. I
whatever.
didn't know that.
Yeah, it's bananas. But like these type-based tests, they're not what we use in research studies when we're studying personality. They are, uh, I mean, they're fun, right? It's nice to get this label, and you're like, oh, that describes me. But
You
they,
feel seen. That's the whole thing, is when you can see it's the same as getting a diagnosis that makes sense. You
Mhm.
feel understood and seen for the first time. So I
I
get
mean, it's
that.
the same thing when you read your horoscope or
I was
like
about to say,
description of
I'm a
your.
huge astrology lover, so yes.
I mean,
But
I like want to believe, and I'm a scientist, so it makes it like a challenge for me. But like I too will read. I'm a Libra, and I'm like, yes, that is me to a T. Uh,
right,
but
but there is such a difference. See, because that's the thing about being super into astrology, is that like you understand how not fixed it is. Like
Mhm,
that there is this shadow side and a light side of all traits. And so and learning to kind of equalize what you found as flaws in yourself and how to like I was a person who was super reactive,
mm,
super. And so I was that was my largest source of shame my whole life. Like I was like, "Oh my god, I yell at people." Really just my family, because I would freeze or fawn in public and then
yeah,
internalize and then come home and take it all out on my family. Like my grandma was always like, "You are such a bitch." And I was like, "I wonder why
grandma.
you're a bitch." But anyway, so I was super reactive, huge source of shame. And then the way that I've really been able to, like, alchemize that is like, yeah, but you know what? I am not afraid to advocate for others. Like, that
Mhm,
fire is
yeah,
very well spent. I just have to learn how to hold it a little better. I have to learn how to forgive myself when I
mhm,
behave like an asshole and ask for forgiveness. Repair is important, but I think that's the part about believing personality is fixed that is scary.
for
Like,
sure,
think
for sure.
about.
Yeah. So I think can become really easy to use as an excuse, right? And that keeps us stuck. And honestly, the only person that suffers when you kind of write yourself off in that way is you. And
Yes.
and so I so a big reason why I don't I also I mean aside from the fact that they don't really have any scientific support, I don't like these type-based tests because it feels like a big undertaking to, like, just change your type, to jump into a new type. This is why I really like, so researchers use, what's called the Big 5 or the 5-factor model of personality, and it essentially is just, like, these 5 broad traits that research ha has shown over and over again across languages and cultures, personality can kind of be boiled down to at its simplest form. And so that's neuroticism, how strongly you feel emotions; extroversion, which is like not just sociability, but how like energetic and excitable you
Right. Is it
are.
super draining when you're in public? Mhm.
Yeah, yeah. Agreeableness, which is like how trusting you are, how humble you are, how oriented towards the good of the group you are. Conscientiousness, how achievement striving, organized, reliable, and openness, how just open or interested you are in new experiences and aesthetics. And I always tell people, like, think about like a sound mixer or a soundboard, those little like levers that you can move up and down to address, like shift, treble, and bass. So think about that with 5 sliders on it, one for each one of these personality traits. And so instead of just like, here's your type, you're one of 16, every single person has their own level on each of those 5 dials. And it doesn't roll off the tongue as easily as like, you're an INFJ, but
Right.
it is like much more nuanced. And when it comes to change, like, well, I'm like a rigid perfectionist and I don't want to be like a complete fuck up when you are switching types, right? Like, I don't wanna lose what's good, but maybe I
Exactly.
can slide it down just a hair, so I'm conscientious, but I'm not perfectionistic. It feels a lot more obtainable.
Yes. I love that. Because, like, the truth is, I could feel intuitively things were shifting in my, I'll say, personality.
Yeah,
But, like, I wouldn't have been able to even express it, honestly, because it
yeah,
didn't make sense to me. So just having more of an awareness of like, of course that's possible. Of course you're capable of that. N- Well, and I think too that's why I always like referred to myself as a extroverted introvert because there was
mhm.
just so many things about that that I didn't understand. And like, are you extroverted or are you a people pleaser? Like what is this?
Yeah, well, and those are, like, different dimensions. You could be extroverted and a people pleaser, like, they're their own dial on your mixer that is your personality. Also, like, what you're describing, like, so many people say, "I'm an extroverted introvert," or there's this new word, "outrovert." I don't know if you've heard, or
Oh, I haven't
ambivert.
heard that.
Yeah, it basically just means you're extroverted in some situations and introverted in other situations, which is just like just a new word to describe what we already know about personality. So personality is on like a bell curve, right? So most people are average. They're in the middle. And when you're average introvert extrovert, yeah, in some situations when you're more comfortable, you act extroverted, and in other situations you act more introverted when you're not comfortable. And then as we go
Right.
out to the tails of the bell curve, there are some people, fewer people at the extremes that it's like, I'm introverted all the time, every day, all day. And people that are extroverted all day, every day. And so like you don't need a word to describe, you know, moderate extroversion because it just means you're right in the middle
Right. See, my
on that
husband,
slider.
he has always like he's an introvert.
Mhm,
Like that's what he would describe himself as, but he's on the extreme. And I'm
mhm.
like, honey, first of all, I think you might be on the spectrum a little bit, but also you feel so unsafe with communication. Like, period.
Yeah,
He shuts
yeah,
down in conflict. He doesn't feel safe expressing, like, his expression is so stunted because he's so
yeah,
afraid of rejection and loss. So I'm like, yeah, it's not just it's more than just the energetics of it because
right.
he that's the part he understands, that
Yeah,
I feel drained in social situations, and I'm like, "Well, yeah, I would feel really drained too if I was having to sit there and overthink every little thing
yeah,
before I even open my mouth," and that's his
yeah,
understanding of being an introvert, and I'm like, "Oh, honey,
yeah.
you don't get it,
It
but that's
sounds kinda
okay."
like maybe some anxiety as well, right? And so it's like it's more nuanced than just introvert, extrovert. And, like, when we're thinking about personality change, like, if he's very, very low, he's not gonna go to, like, life of the party, but it's like, how could you nudge that up just a little bit so you're able to connect better with, like, your 3 people in your life, or you're more comfortable expressing yourself in certain relationships so that you can live more in line with your values or have the types of relationships that you wanna have. And so personality change doesn't have to be this, like, dramatic reinvention, it could just be like a fine tune, a tweak.
Right. What are you seeing, or like, what's an example of a type of personality that maybe a listener would have that they might believe is super fixed?
Yeah, what's a good one? I mean, the ones that come up all the time for me are people that have difficulty trusting because, I'm just not a trusting person. Or I'll hear, like, one I hear all the time is like, I'm the type of person that needs the adrenaline of the last minute to get started. It's kind of like lower conscientiousness. So there's that one.
Mhm.
Another one that hear a lot, like, I'm just a perfectionist. I'm just like this. I couldn't not be. And you hear that with like people pleasing too.
Yeah.
And one thing I do, you said, like, there's a light and a dark side to every trait, and I think you were maybe talking about, like, the zodiac at that point, but this is, like, super, super true of, personality too, It sounds, like, much better to be, lower neuroticism than higher neuroticism, but, like I said at the beginning, like, I think that I'm, like, on the neurotic side. I actually think it makes me a lot more empathetic. It makes me a better therapist. It's good for my career. Whereas, like, I have another colleague who is, like, very stoic, also a psychologist, very stoic, and he'll come to work and he'll tell me about how his wife gets mad at him because she'll come home from work and be like, "Can you believe this thing?" And he will just be like, "It'll be okay." And she's pissed because he's not expressing like, appropriate emotional outrage. So, like,
Right.
traits that we think of as really good are, there's liabilities at both ends of the spectrum, right? Like, really
Absolutely.
high extroversion is like, can cross over into like sucking all the air out of the room, right? Really
Yeah.
high conscientiousness is that rigid perfectionism. Really high
Over
agreeableness,
functioning.
again, sounds nice. People pleasing.
Absolutely. Oh man, and I'll tell you, whew, the way the pendulum has swung in my life. Cause I in my early 20s, I was kind of chaotic. Couldn't really plan, wasn't really an on time type of gal. The guy I married at 20 was pretty on time. And apparently I like to marry people on the spectrum because I'm pretty sure he was too. But there was some things that were like, no, this is the rules and we follow the rules. And I was like, I'm a rule follower. Okay, so we're on time. So then after divorce, and I'm a single mom at that time of 2 boys, I'm having to learn, like, for the first time in my life at almost 30 years old, like, okay, how do I create a schedule for my life? Like, because I
Yeah.
had, even though I had graduated from grad school, I had still stayed at home with the boys. So this is my first big
Mhm.
girl job, and I've got 2 kids and whatever, and I'm like, "Okay, huh, how do I function? Like, how do we do all of this?" So then I got rigid. And
Mhm,
then when
mhm,
my 2nd child had behavior issues and stuff, I overfunctioned for the whole family unit too, because I was like, "Oh,
mhm,
well, I have to keep things at this level so that he's not overstimulated, blah, 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 all the things," and overfunction. Everything was
mhm,
scheduled to a T, and when my 2nd husband would, not like, if it was his night for dinner and it wasn't ready at 6, catastrophe, and also
mhm.
a lot of morality being assigned. Like, I just can't
Yeah,
even
yeah.
believe a person wouldn't have dinner on the table at 6 o'clock. Like, who
Mm,
are you? Like, all this stuff.
yeah.
Then, as the years went on, and, my mental health peaked and whatever, ups and downs, really kinda chaotic again. Like, not super, but now I feel like I'm in a balance where sometime, like, we have a general
Yeah.
structure of things. I can get everything prepared for the week. I can, think ahead, all of that, but I'm not like, applying morality or meaning to
Mhm.
situations that it doesn't apply to. But before,
Right.
those stories were very real. We have
Mhm.
to be perfect at this and make sure our schedule is being stuck to and all the things because people will die if you don't.
Yeah. I mean, it's really scary, or it feels very life and death. I mean, I get that too because I also was not a particularly, I mean, people are always shocked when I tell them, but like not very conscientious. In fact, like was kind of a hot mess, like messy and lazy and like, I mean, I am like a professor and I failed math for the year in high school because I just like didn't go to it.
Yes,
And it wasn't until but I had like other good traits, right, that were helpful for me.
sure.
I was like, very empathetic and very agreeable and like was very relationship oriented. And it wasn't until I realized I want to turn that into a career and my low conscientiousness is going to get in the way that I was like, I need to make some changes. And I think like as I became like be practiced conscientiousness, right? Like started to get reinforced for it, like started to get, positive outcomes and praise and regard in my field. And so the pendulum like really went the other way. And then I had kids. And man, like,
Exactly.
yeah, right? It's like, though, your toddlers do not adhere to a schedule. They
They do
don't.
not care.
Yeah,
Mm-mm.
they don't care, and, I found that, like, if my daughter would skip a nap when she was little and I was planning on using that time to, like, catch up on my emails, I would be, like, super anxious that people are gonna be like, "Oh, Shannon's lost her edge," right? So you'd be thinking about the emails while I, like, was playing with my 18-month-old, I wasn't there.
Yes.
And so that's where I think too, like, personality we can make changes to our personality because they fit our values at a particular time in our life, and then we have kids or we retire or like our situation changes, and then we might feel like, well, my values have kind of changed, and so maybe I need to show up differently, and that's 100% doable.
Yeah, and I think if you have the belief that it's fixed, maybe you're not gonna realize your values have shifted and or understand that when they do, it's fine for everything to shift a little bit left or a little bit right.
Yeah.
Like,
Right.
your hierarchy of needs can change, all
Totally.
of the things.
Yeah, absolutely.
I love that. Man, well, I have loved having you here today. Tell us, so you wrote a book or releasing a book?
Yeah.
What's the deal?
Yeah. So, a couple things that I can like sort of offer to listeners. So, if you're a person that likes personality tests, like I do, I have a free one on my website that is this big five like evidence based science backed personality. It's free, so you can just go and take it, and you can get a little bit more nuance via into your Enneagram or Myers Briggs type, and that's just at my website, shannonsauerzavala.com, no hyphen, and then yeah, BPD Compass, the treatment that we've developed in my research lab, is coming out on August 1st as a workbook that you can pre-order it now from Amazon.
Oh,
And like I said, like it's meant to be a generalist, personalized, personality focused approach to borderline personality disorder, and meant to make treatment for this condition that has historically been thought of as like, oh, for specialists, much more accessible. So check it out. We're really excited about it.
I love that. And I'll make sure that I include all of that in the show notes too.
Perfect. Thank you.
Thank you so much for being here today. I had so much fun with you.
Yeah. Thanks so much for having me. This was great.
Good. Okay, I'm going to press stop if you'll hang out for 1 sec.
Yeah, sure. Of course.
Thanks for coming to Emotionally Unavailable. If you haven't already, like, subscribe, and share. Emotionally